Okay, I want to turn the discussion about it a little bit to, again, to Kyla. And any type of cooperative action or interaction, I guess, with the Chatham Kent Clinic here located at the plaza. I'm looking for an assessment, I guess, in terms of joint action and use of shared resources or shoring up of our capabilities here in conjunction with whatever Chatham Kent might have to offer. So maybe you could provide what you know, I guess, on that.
I don't really know a whole lot. Like I said, I'm just new to our role and trying to get everything situated in the health center and get into that. I have been involved with them prior, but a lot of their mandate is different than we look at the Chatham Kent Health, like public health, is different than their office as well. So they're kind of compartmentalized of different types of health that they provide. So they're more like a kind of family health team approach. So if you don't really have a provider there, then you're not really their client, and that's how they work like that. I haven't had a chance to sit down with them yet and see how we're going to work together on different things. We do have joint meetings coming up, but I haven't had a chance yet to sit down with them and say, okay, what exactly do you do for us?
Yeah.
Because in the past with a lot of the health teams, I'm only aware of the one in Kettle Point. That when I worked in Kettle Point, I was like, we have an emergency, or can we get somebody to look at this person like right away? They're like, are they a client here? And it's like, well, no, they don't have a doctor. Well, here's a form they can fill out. Otherwise, they'll have to go to Emerge. So they don't really interact in the community necessarily. They'll provide programming and things mostly for their clients. So that's something that when that program was established, was that that should have been looked at exactly what are they doing for the reserve, because it's to my understanding that they do have a lot of non-native and non-First Nations clients that come and get services there as well, because it's open to them. I don't know the exact numbers or anything. The other thing that I've talked to the pharmacy, I don't know exactly how they fit in either. I haven't had a chance, but I did speak to them. And a lot of the stuff that we're paying for, if they would get their prescribing privileges at that pharmacy, we wouldn't have to pay for different things like head lice shampoo, Tylenol, all those kinds of things that could be just thrown through non-insured health benefits. So I'm trying to work with them to get that kind of program. So to tell you what services we do together, we do nothing together so far.
Well, I guess that opens up the discussion, I guess, in terms of the need to work on a cooperative basis to work at common goals, I guess, within the community for a healthcare service for us. Certainly we know what the services are, to a certain extent, provided by the health center located across the river, near the river, I say across the river, near the river. But we don't have a full, I guess, appreciation, I guess, of the potential services that we can get out of Chatham Kent there. And my concern is that we don't want to get into a condition where there's a situation where we're overlapping services and trying to address the same client base. But we should be spreading out the menu, I guess, to cover as many gaps as we can, I guess, in terms of healthcare services. And one of them that I picked up on yesterday in the discussion is that, so whatever it means that they have the ability to track people, I guess, in the Chatham Kent area that perhaps come into our territory here. And there appears to be, I guess, a will there to work together, but at the same time, as the chief of this community, I still don't get the relevant information in a timely manner, I guess, to share with the council and the community as to potential threats, I guess, in terms of infections, or they're tracking a contact
Okay.
and all those type of things.
you're looking at two different organizations
Okay.
then, because the Chatham-Kent Public Health, they're the ones that identify positive cases.
Chatham Public Health,
Yeah,
as well as the clinic located across the way here. But one of the ongoing concerns is that is that there are people that are coming from off the community, and we don't know what type of infection they have. And maybe that should be disclosed to us, I guess, in some manner or form through your department there, through some type of joint communication. I know in the past there was a discussion that there be some type of memorandum of understanding or undertaking, I guess, in terms of those types of services provided by the clinic in conjunction with your department on behalf of the band council. And I don't know where that is. I understand that perhaps the agreement with Chatham-Kent is up to for consideration or renewal, I guess. And I think it begs the opportunity to open up a wider discussion, I guess, in terms of covering off as much service as we can between the federal service that you provide and the service that Chatham-Kent provides to better serve the community. Yeah.
So the community, Chatham-Kent Community Health Center that's located up in Wall, does take in new people who don't have a doctor. They do have to fill out an application and leave it with them. If it's immediate, they may be able to be seen by a nurse practitioner. In the meantime, it probably, if it's urgent, it would go to the emerge. If you are a client, you would have a doctor or a service there, but they also service non-clients with any of the programs as well as their social work program. And if people needed to be serviced from off the reserve to come on, say we would close the bridge, they have two other sites. They have Wallaceburg site and Chatham site that the practitioners could go there and see those off-reserve people. So they don't, that probably could be worked out with them. And there is a MOU that has been signed between the band and Chatham-Kent Community Health Centers. So that would have to be looked up. I'm not sure when that's due.
James?
So the table we had with the Chatham-Kent Community Health Center is they would give a quarterly update to the health portfolio. It was Alan Jacobs under the MOU. And during the first wave, they did discontinue a number of their preventative care services, I think almost all of them, and their primary care services were reduced considerably. So there were, because we did discuss the opportunities to collaborate with them, and there weren't very many opportunities. Some of the physicians said they would be willing to help, but we weren't successful with that. I guess one thing to keep in mind, they do provide some preventative care services that at times overlap with the health center. So there are certain cases where both may be eligible for the same external funding. So that's one thing that should be sorted out. But generally speaking, they report to their board, and it's more or less a satellite of the Chatham and Wallaceburg Community Health Centers. So what happened in the first wave is most of the staff were recalled to Wallaceburg and Chatham, and the bridge. I had access to the information of the number of non-members that were accessing those services. It wasn't a large number, but if it was something that we were interested in access.
on that as well, I think that we have to make a clear, communicate that the health center is the health center and Chatham-Kent is Chatham-Kent. Because if you Google Walk Island Health Center, that comes up. We field probably about 5 to 6 calls a day for them. We get clients rolling up saying, "You didn't call me about my blood test." And it's like, "Oh, I'm sorry, I didn't know you had one." Like that kind of thing, where people aren't understanding that they're still us. It's just that they have different services there. But I guess they include themselves as a Walpole Island Health Center. So it's confusing for people. So we have to work on that communication as well. And just let them know that there are 2 different services.
I guess with our specific subject right now, I guess that there should be some type of ongoing dialogue between the health center representing the First Nation and Chatham Kent there to see what type of joint action can be taken to address the COVID-19 situation there. It appears to me that there is no active dialogue to address it on a common front, and that I think discussions on that between the supervision and management of the Chatham Kent Clinic and the health center should be considered immediately, I guess, in terms of what can we do together to best fight this second wave that is here, and it's going to grow, I guess, in terms of its intensity and impact.
Okay. With that as well, most of the public health stuff doesn't come through them. It comes through the public health unit. We're not in the catchment area of Chatham Kent is the big thing. All of our communication goes from Sarnia, Lambton, Sarnia, Lambton. So usually they have our communication. If Chatham has anything that needs to be relayed to us, they're supposed to go through that health unit and get a hold of us. So it is happening, but it takes longer. So we want to make some sort of way that they can communicate with us right away, that if there's a contact on our reserve, we want to know, like now, not after it goes through all these other people.
Well, I guess in my limited experience, I guess, with them, with the Chatham Kent, I understand that there's Aboriginal profile dollars that come down from the province, I guess. And, I guess that in part helped them to be situated on Montreal. And look, we serve as a First Nation, so we're located here. And I think it comes through, I don't know if it's still there, SOHAC or whatever it is.
Their funding, no, that doesn't come through SOHAC.
They have an influence though in terms of the decision-making of funding in our specific area.
SOHAC does. That actual one though, it's confusing because there's funding going back and forth between them.
Right, yeah. But
So-
my impression is that they do in fact receive some Aboriginal funding, and we don't have any type of control as to council as to what those priorities are. They determine their own priorities on how they're going to best serve Waffle Island. And that role should be reversed, I guess, in terms of our input into those priorities for dollars spent to receive.
Yeah, so it's flowed through the LINs, it'll flow through the Ontario Health Centers, and they're more closely associated with the CKJ, the hospital, in terms of governance, but they're still standalone. Whereas Chatham Kent Public Health is more closely associated with the municipality, so very much a separate organization. But they do access funding through the Ministry of Health, so that's the comment and all.
They do, and there's a whole other discussion point, I guess, in terms of the reorganization and how it's going to affect us. Because there is an Aboriginal, as I understand, an Aboriginal interest, a component of that discussion.
I just had a question. I thought that we had some sort of a seat at the table with discussions with both Chatham Kent Public Health and Lambton Public Health. And that Tracy was previously sitting at the table as a delegate of the chief.
I'm not aware of that.
So she was sitting as the delegate of the chief for a table with, it was primarily emergency management coordinators.
Okay.
And that evolved to chiefs and mayors being invited to that, and that was Lambton specific. We're also have a strong partnership with Lambton Public Health right now. Because they're supporting us in direct service delivery. And I think it's safe to say we don't have that relationship with Chatham Public.
And we've never really had that relationship with Chatham Public Health because we're not in their catchment area. We have done things because our kids go off to school in Waldesburg and things like that. Our people go off to the hospital and things. So we have had that relationship in the past. It's not as strong as with Lambton, but because we've done contact tracing for tuberculosis and different things, we've had communication. It's just a sense of, because the different roles of, like, I wasn't even sure what meetings I'm supposed to go to because of the line of communication. I wasn't sure what Tracy was going to, what I was supposed to going to. So I was still getting that kind of stuff sorted out just because I just started and I'm just trying to figure out where I'm supposed to be. And now that she's off, it's a little more confusing.
I guess that whole situation illustrates the need, I guess, for some type of organizational mapping, I guess, in terms of our participation and responsibilities in those various areas. Because I am totally unclear as to the role and input this council has, I guess, in terms of that clinic being situated there, the types of services it's supposed to be providing to our community, where their sources of money comes from, and does it compete directly with those dollars that you might be going in? That is my concern.
And one last item, we did have a choice between Lambton Public Health and Chatham-Kent Public Health in terms of supporting our own testing. So we could have relied on Chatham Public Health, but we made the choice in consultation with council to partner with Lambton because we already had partnerships.
Yeah, we already have a really strong partnership, like I could pick up the phone and call them like any time and they answer. Whereas Chatham, I call them and it's like Hope 1, Hope 7, Hope, so I don't have that same relationship.
You go.
There should be 2 tables at, Rosemary sat at, as well as Pat Stewart. And there is a Chatham-Kent, Indigenous Health Partnerships meeting, as well as one in, Sarnia-Lambton. And both those meetings have attendance of Rosemary. And also, I don't know if the health, one of the health portfolios from Chicken Council would attend as well. The one in Chatham-Kent is dissolved, so they all meet now, they kind of host all the way around. And it is the LINs from, Southwest region that meet, and Indigenous partners, so whenever somebody comes, California, Sarnia, Mosul, and Mexico.
Yeah, I've been involved with that one when I was at the Secretariat, so I was kind of involved from the start at that end. And it involves the direction from the LDCC. And I think I sent that information to you, Charles, about that, because they are, the Health Declaration for Indigenous Peoples. They're putting that out to all the people who are planning to become the big organizations of the Ontario health teams, right? So all of our LINs and everything are all being restructured. So different places like Chatham-Kent Health Alliance, Sarnia Blue Water, they make this proposal and they do have a section that says, do you service Indigenous people?
Right.
Rather than them checking off, yes, we do. We have 3 reserves right by the area. The LDC wants to say, no, you have to consult us in these areas and you have to do this specifically. So that's part of what's going on there. A letter's gone out to the Minister of Health and Long-Term Care stating that the LDCC says this, and this is what we expect from anybody who's using our numbers and us as, yes, we've fulfilled our Indigenous services and things like consultation and things like that. So that's gone out, and we're just working with the different areas, the different LINs, the different Ontario Health Team applicants to make sure that they do get cultural education, that they do know how to do land acknowledgements and the things that go with that, that they do know what systemic racism is, all those kinds of things, that we can control that, and that once they fulfill those are consultation. Like all the things that we list out, this is consultation, not just you checking off the box. So we are doing that. It's just kind of slow right now because of COVID.
I think, could you do a quick 30 seconds on each in terms of description of what is a LIN and SOHAC? I got a feeling that some of the council members may not be familiar with those acronyms.
Okay, a LIN is a local health integrated system. So they used to be like CCAC. They're the ones that are set up provincially to provide services and make sure that services are done in the community. So they are part of the people that communicate with the hospital and saying, okay, this person needs help at home. Those kinds of programs to kind of fill in the gaps. the Ontario health teams looked at these and said, oh, we should be able to push these together in different areas to make sure that we have this big organization that covers all these areas. So each area, like Blue Water Health has Erie, St. Clair, Lynn, they have to make application to become one of these Ontario health teams. SOHAC, on the other hand, is, I can't remember if it's provincial and federally funded, it just depends on the programs, but it's a Health Aboriginal Access Center that came from Aboriginal Healing and Wellness a long time ago. And what they did was they looked at different sites off reserve generally and said, okay, our people need health access. We're going to put a center in Windsor, we're going to put a center in London, we're going to put a center here and there. So they have those, and they're they're Indigenous specific. LHINs aren't Indigenous specific, they just have to service us basically. But that's what SOHAC is. SOHAC actually put in an application to become an Ontario health team through London. The London site with, I think it was Brian Dopease put the application in. The only thing with that is that he used all of our numbers, but he didn't do consultation with us either. He just said, yeah, we service people in all these places. So it's not just outside people doing it, it's our own people just saying, yeah, everybody's on board with this, where they don't have the authority to speak for us.
That's right. Any questions? Keaton?
I guess this would be maybe more specific to James. Are there any specific decisions that are needed to be made today?
Yeah, the specific decisions would be around essential programs that either have to run or we're strongly recommending they continue to run while we schedule the testing.
I guess my instruction to administration would be this: one, that we look at as quickly as possible the rebooting of the financing department, and that they be a priority, number one priority, I guess, in terms of the testing, because the person that was affected from off the reserve or from another community was in direct contact with individuals in that particular area. So I think that that should be a priority for, I guess, rebooting, but also for the testing itself. And that the rest of the governance building should be tested as well, including chief and council. And from there, I would see that the next priority would be Ontario Works, because of the necessity of that service for our community members. And those services, and that they come back online as quickly as possible as a result of the deep cleaning efforts that hopefully are on their way now. Next, I would see the number 3 would be social services, and to identify a core set group in there, because there's a number of things that have to be addressed on an ongoing basis, whether it's CAS or health type of services, not only for children, but for elders as well. In conjunction with that, there should be an emphasis on looking at home and community care at the same priority level. And next, I guess, and they'll probably more or less take care of their own interests, would be the police and fire departments, but they should be given instruction to be not only COVID-19 conscious, but also prepared, I guess, in terms of providing their ongoing services to the community.
And,
Yes,
and there was some clarification requested. Are we going to be requesting tests for all of the volunteer firefighters?
That might be applicable, yeah, they're coming in contact with everybody. I think that it would be a good practice if they're under our broad umbrella, that they should be tested, and we should establish some type of ongoing data bank for that baseline data for future use. And with that future use, I would suggest strongly that on a structured periodic basis, that all employees, including council, get retested. Because we all go out into other communities, we all go out to Chatham, Sarnia, etc., for whatever purpose. And we come in contact with others, and I think it's only fitting that we have periodic testing, ensure the integrity, I guess, and health of the community. Yep.
Now, I just want to add a few more. Waterworks is one that cannot shut down.
That's right. Yep.
So the expectation, they would continue to report to work.
Yep.
Another maybe central registry, because they're providing Canada Post service for a number of members.
Yep, and we got to have a broader discussion on that, I guess, in terms of bringing that service back to the main Benton office. I don't know why it's isolated off into one area there. I would like to receive my mail directly. I don't like it being filtered through other hands, I guess. So at some point, we're going to have a discussion that the departments receive their mail directly, the way it should be, because there's important agreements or notifications within that. And at times, those things get lost because of the paper shuffle. I've seen it in the past. I guess where an amendment for funding is requested and it's sitting in the registry or somebody's desk because they've got too many hands to go through to get proper attention and follow up on it. So we're going to have a discussion on that at some point in time.
The other thing that they take care of now, with new staff coming on at Canada Post for delivery to households, there's been a number of households that they've identified as being beyond their mandate to deliver mail. And this was before I came on, but Central Registry was tasked with receiving that mail. And
then we should open up negotiations to have a satellite post office then on the reserve here.
Yeah.
Port Lambton has one, smaller communities than us have a post office. I think we have an excellent point of demand to have that type of service on the island because we had it in the past and it would employ some of our people. Even on that point, I think we should be demanding that the mail be delivered by, coming to Wapol, it should be delivered by First Nation residents of this community, as opposed to being continually contracted out to somebody off the reserve.
I agree.
The other point I want to draw attention to is the function of the retailers. I think that we have to put some type of policy in place, I guess, to provide them with instruction on terms of how they're to operate and function during the COVID-19 situation. I think that they should be provided with specific guidelines that are identified with the legislation from the province in terms of putting up the appropriate shields and other mechanisms that are identified within those specific pieces of legislation. I believe there's two specific acts. One is the dealing with a shutdown, and the other one deals with the reopening. And it's identified on site from the province of Ontario. So you might have a look at that, I guess, in terms of looking at dealing with the retailers. And again, we're going to have to look at some really hard focused discussion on that area. I don't know whether it's going to be through the Development Corporation or through economic development, where we're going to have to filter it down to the appropriate responsibility to Department of Responsibility to handle that on our behalf. I know it's been attempted in the past, but we have to pull up our bootstraps here and take some responsibility for the operation of the retailers, including the cannabis shops as well. It's a very unstructured, unlicensed type of operation, and we don't know what type of quality of product that they're selling to the general public there. So again, that's another decision point that we have to look at, I guess, in terms of our ongoing operations. Is there any additional areas that we can have? Cody?
Yeah, for resource protection, with the news being released that we're shutting down all programs, the outside community gets a wind of that, we're gonna have a lot of non-Aboriginal hunters coming into our territory, knowing that we have no eyes and ears out there. So I think that's a very key program that needs to keep going. Also, housing.
Yep.
There's people that have roofs that need repairs before winter time. There's elders that need walkways done. There's continual maintenance on homes that need to be addressed during these times before we hit the winter season. Also, public works. You know, we can come up with a COVID guideline where maybe they have half the crew come in during half a week, the other half comes in the other half a week. But shutting down, that doesn't mean that the wind's gonna stop and the rains are gonna stop and all the weather's gonna stop. You know, we have trees falling down on roads, blocking main ways that emergency vehicles can't operate full extent when this happens. So that's a key program that needs to be open as well.
Marcia, did you have your hand up?
I was gonna say public works.
Okay.
Lee already mentioned it.
What about, did you have your hand?
Education, is education still doing those?
Yeah, education, we're gonna leave that to the end there, but we're gonna have a full discussion on that point, okay? Anybody? Women's shelter, yeah, we need to have a minimal crew there.
They identified all the essentials, and we kind of had a brief discussion yesterday, of like nurses and police, extra police are talking at the bridge, but I think in waterworks. But those essential services, if we have an outbreak, just stay, we're being proactive. Do we have other people step in afterwards? Is there like an A, B, and C day where you have 3 sets of workers so that if somebody gets sick, you can rotate other people in? They necessarily don't have to be on duty, but they should be trained to be able to step in to fill those positions. Just saying, because if everybody gets sick, even like resource protection guys or whoever, you don't have enough people in those spots. So you should have, just like a levy, to have extra people in those trained and ready to go.
You're absolutely correct, but we should have a whole list of contingency plans in terms of various areas of critical services. James?
I just want to turn to 2 more decision points for right now. One is, we've gone ahead and provided medical transportation today, and the question, do we continue that over the next 2 weeks?
I would say yes, that we have to. There's people that rely upon that service for dialysis or examinations for either diabetes or heart conditions, etc. And we have to continue on with that particular service. I don't know if it means bringing on additional drivers that are qualified to help beef up that driving complement, but that should be a consideration that should be made by senior management to consider there, because we want to spread out the task and limit the exposure, I guess, potential exposure for the drivers and the patients and the places that they have to visit. Because we don't have any control over the places, the hospitals or doctors that they visit. And those are possible sites for contact or exposure to the virus. Ron?
Sorry for a follow-up. I forgot to mention that we had a kind of a discussion in outside, and a lot of people do taxis. And back in 2019, and a couple of counselors that are here can attest to this, that we made a motion to have the whole Benuji bus brought up to speed so that it can service our people that don't have the ability to take a taxi or whatever into the Wallaceburg or Chatham area, either for shopping or appointments. It sits in the parking lot, and we gave the last director of operations the task to do that with the administration. It's our asset, so we should be utilizing that, and because it's handicap accessible as well, you can put a wheelchair in it.
As well as, I think we do have also a complement of black Nissan transport vans that I believe that are underutilized, and I think that we should look at opening up the use of those particular vehicles to van members, either to transport them to Wallaceburg or to other doctor sites there, and broaden the use, I guess, of those particular assets. If you have assets and they're just sitting in the driveway, they're no use to you.
I was asking about that because I have staff members that are asked to take clients in their own vehicles, and I don't think that's safe, like infection control wise, because then the person doesn't know who was in their car, like if their kids were in their car or whatever. But just from like a licensing, insurance and all that type of thing. Yeah, they might have insurance, but are they going to break down or anything like that? We don't know what kind of repair their vehicles in. And if that person needs that support from that staff member, they should be able to take one of the vans and take that person with them.
Well, listen, you've identified a whole list there of potential liability issues where a staff person has to take a client or a patient to a site for their treatment or whatever they need. I think that we shouldn't expose them to liability. If it's a vehicle that's covered under the van's blanket of insurance, then that vehicle should be identified and used as opposed to a personal vehicle.
Thank you.
And let's do it that way, as long as the driver is properly scheduled or the license code, I guess, for that service. I don't know, they used to call it a chaperone, the license.
I was just wondering, in terms of medical transportation, are they still transporting multiple people in one vehicle that are going to different appointments? And is that okay?
know of.
doing?
I think
Okay.
on occasion, there are people that both go to dialysis and things at the same time, but I'm not exactly sure on that.
Okay, because I know there have been concerns in the past about people transmitting things in the same vehicle. And also maybe we could look at getting some barriers for the bigger vehicles. And we should have some sort of a policy on disinfection between, if it's being shared between different programs and different groups.
James and Marshall.
Another immediate decision point is we have called off the VFWs today, and I've informed them we'd be discussing that today, whether we continue that service over the next 2 weeks or if we prioritize them and wait until their test results are available.
Because the service the elderly, I would suggest that they get tested. They'd be on the priority list for testing. And once we get some results in that they would continue with their services, and that would be a priority. If it addresses the needs, I guess, of the elderly, then that's at the top of our priority list. Let's get that done in the appropriate, proper manner and continue that service. I see Marcia.
I would consider Ontario Works and the food bank as essential as well.
And I have to remind everybody that we're just doing this for 2 weeks, and that we're acting on a very extreme precautionary measure, but it's a good trial run, I guess, in terms of any event coming at us, I guess, in terms of a massive wave of the COVID-19. As Kyle has indicated, that wave is here, and we're feeling the trickles, I guess, on our feet beside the lake shore. Well, if we look out towards that lake, we can see a massive wave coming our way there. We have to be prepared to address that challenge when it hits the shore. So hopefully we're doing the right things, I guess, in terms of identifying the soft spots, I guess we have in terms of a strategy and an action plan going forward to address our needs, and we're doing a very good job of that this morning. Cody?
Yeah, just a suggestion. A lot of these programs, do they have a daytime maintenance person? Maybe it'd be a good idea right now to look at hiring maybe a handful of band members, just 5 people to go clean up all of these programs and have that just instead of their job, like the van and the vehicles. After usage, these people can be utilized to clean the van, to make sure that they have proper PPE, to make sure everything is clean. Public Works doesn't have a maintenance man. That'd be creating employment for those that don't even have jobs right now. Cleaning isn't hard. It's not you don't have to have rocket science behind your qualifications to go out cleaning. So during these times of the pandemic, they highly suggest that everything is wiped down, everything is sanitized, everything is clean. They can go doing, hey, we got to go do the door handles at Public Works before they open. We got to go to the health center. We got to go to the band office to do some tidy up. They could have like a mobile maintenance unit. That's just a suggestion I have.
Hey, James, you can reach out to Employment and Training to see, I believe that they have lists of people that are ready and able to work, as well as Ontario Works that has their database or their list of individuals that could potentially be put into service for cleaning that's necessary within the departments there. I think that's an
Yeah.
excellent idea that we have that service for us, and maybe it should occur twice on a daily basis, halfway through the course of the day, then obviously at the conclusion of the day, and et cetera.
So employment and training, we've channeled those funds for a number of cleaners, primarily in education. So we can look to see if there's opportunities to do that within the existing funding envelope or potentially COVID dollars, if that's what you're.
As I understand it, Ontario Works has a nice lump sum of COVID dollars there that is in need of some type of utilization. And if we can get some people to work with those dollars to provide those cleaning type of services or other services that we require, then let's do that. Elaine?
Okay, two things, PSW, do the people that the PSWs work with get tested and screened before the PSWs go in? I guess Daniel would know that, the manager there, but I just wondered, like, do the clients get screened before our PSWs go into the homes?
They are screened, they're not tested. It does bring me to another question though. Some of our workers at home and community care are tested on a regular basis, and they had asked whether they would be included in this, but my assumption is they would be if we're trying to achieve
Yeah.
a baseline.
And the other thought that I had was about the cleaning services. We discussed yesterday that professional services would come into the overall cleaning and sanitizing of the programs that are needed, especially the governance building. Are we not gonna do that anymore?
I would hope we are.
I understand it. Yeah.
It should be underway right now, shouldn't it? I see heads nodding, I don't see an affirmation.
If we're pre-planning and we get the professional, services coming in, can we also include in that maybe to train all of our local people who are working within these different programs on the proper sanitizing techniques, or can someone from the health center even show people proper sanitizing?
Yeah, there's, from the Public Health Association of Canada, there's actual guidelines. There's guidelines from the CDC for specific buildings and things like that. They have everything down to what type of cleanser you're supposed to do, the type of dilution of different types of things that should be done, timing of cleaning between individuals, all those kinds of things. There's guidelines out already, and we can set something up to educate the maintenance people, because I'm pretty sure our guys need to be reminded of that. It's just something that should come second nature. Okay, there's this, I gotta wipe down. That person was right there, I gotta wipe down. So it's something where they should be the busiest people in the whole organization right now. They shouldn't be hiding in the closet or anywhere else. They should be out in plain view of constantly wiping things down. So that's something that we can look at, making sure that they know that training, that they have the supplies too, because you don't want them to say, oh, okay, I'm gonna go back, but I don't have that at my office or stuff. So we gotta look at making sure they have that.
Okay, Elaine, then Lyle.
And then we have to remember that certain buildings, not just any person can walk into the children's center. There's only the employees that are allowed to be in that children's center. It's under the Ministry of Ed guidelines. No one else can enter that center unless they're on a contract or college, and they have to stay specific to those limited number of people. So you can't get different people to come in there and clean unless you do it on a professional basis. Because I know when the ministry has certain guidelines, and they had to develop their own clothing policies for that center to open back up. And that was one of the policies, that no one can enter that building, not even the parents. So just be careful, like how many people are gonna be letting going into the school. And I think the administrators of every program should know the things that shouldn't be on the walls or the daycare had to get rid of their carpets. I mean, things like that where you can't thoroughly clean things, we have to keep in mind of those things in our programs.
Okay, Lon?
Elaine kind of touched on what I was going to talk. As far as utilizing these vehicles that we have that we're not using right now, the buses and the vans. Sanitization is one thing, but are we inviting people to come out of their bubble and interact when they're going to town on the bus, if they're going to groceries or whatever? That's an issue with me, I think, we gotta be careful of. Another thing is with, notification as to who's getting on the bus and where these people are going, community care. Please have a call. When the call comes in, the dispatch is already notified whether or not COVID-19 is in that home. But nobody else knows, only the dispatchers. So there's information to our first responders that have to go to attend to anything. There should be some contact where, through the health center or whoever, that if there is COVID likelihood that they should be notified prior to one.
Correct, yeah. Okay, I want to focus on the last piece, and good discussion on the operation of the school there. I had some issues arise and brought to my attention. One that was concerns, I guess, about the food handling over there and the cleaning around the food areas, the use of cleaners, etc. And picking up on a point that Cody identified there, that we should look at providing additional cleaners for the operation of the school during the daytime there. We would be hard pressed, I guess, to demand that the existing complement of staff there do all the things that we're expecting them to do, because there would not be enough hands to do all that work. So I think we have to seriously look at putting some additional cleaners in the school there to ensure that the classrooms, the hallways, handle points, and touch areas are obviously sterilized and cleaned on a very frequent and basis, I guess, to ensure the safety and health of the community there. So I want to bring that up as a discussion point as we conclude our meeting here. Elaine?
I'm not ready to conclude the meeting, but
Okay.
as administrators though of the programs, I think that we need to be asking them, what do they need? And ask them, who can they allow into their program? Can they just allow anyone into the program and go clean? I'm not sure about that. But the other point I don't want to forget is that community is saying, what about us? How are you going to get information out to us besides social media? Like people that don't have Wi-Fi or anything like that. Like, what are we doing for the community members? They're important people too. And right now we're just discussing the program, but we need to discuss how we're going to get this out to the community.
James?
So the daycare was one of the first outbreak management plans that we brought to council for approval, and that was a ministry requirement when we reopened. And so we have dedicated cleaners in each pod at the daycare right now. So I think the service standard is fairly high. We followed a similar process for the elementary school, but we could probably revisit that to see if we want additional
I
cleaners.
think the question is getting the message out, not the ability of cleaning. Maybe you could answer her question specifically. It was a communication issue, I believe, not the cleaning approach.
Well, my suggestion in terms of getting the communication out is that we go back to door flyers and utilize the radio for important messaging. And that was a necessity before because of gaps in internet access.
And I think our radio station is a lifeline to a lot of people. And I've heard this morning on the radio that, oh, we're not going to do our program today because we're shut down. But I would like to see programs still doing their radio programs because a lot of people depend on it who don't go anywhere in their home.
We can open that up. Amy, then James.
And just for clarity, in terms of door-to-door messaging delivery, we're still talking Canada Post, right?
We would generally do Canada Post when we were able to. Remember, there were some times where we couldn't wait for the weekly mail out and we'd go door to door.
Yeah.
I just want to mention, because I have the essential workers in the communicable disease work plan, and radio announcers are in there. I think we've covered everybody else in our discussion.
Ron?
I think there should be a communique go out too, we're talking about our citizens and communication, and flyers. We were told yesterday that there would be bulk flyers that go out door to door, whatever, the event, how they hire somebody. But I think too, from people that come from outside the community, that are our community members or citizens, have the right to be here. But we identified that as well, as they're coming from hotspots. There should be something going out to them saying, if you're in a hotspot, please stay where you're at, or please try not to come here, because we're trying to keep it, the integrity of the community of not having those high infection rates coming in. Use your discretion when coming here, unless if you have to absolutely do some sort of physical business. And likewise for that should go out to people that are coming in, either through the radio station or media, that if you're coming in to get gas or go to the dispensaries or whatever, get in, get out, please go about your business off the reserve. That's what should be said.
Can we
You know,
put an
encourage you to use
advertisement?
it, but
Sorry, I was going along with that. Can we put an advertisement in like the Courier Press? Is that still a thing?
Sure.
Like put a big thing, thank you for your support of all this stuff. We want to remind you that if you're coming to our island, we'd like you to maintain these things, and then just say blah, blah, blah. We can put it on our Facebook site, we can put it on everywhere, but make sure it's in the newspapers in the area. Just so they know that, hey, we don't want you here if you're not going to do what you're supposed to.
And we'll get Derek to work on, drop a message on that, pull that all the help with. James?
We did something similar for the cottagers, because we found out that Nawash and Kettle Point had tried to stop cottagers, and then they appealed that process, and so instead we sent letters asking them to stay home, and we had almost 100% compliance. So it does make me wonder if we could do something like that for officers.
I was thinking about that yesterday evening, where we have an established list, and I was thinking about the Christmas distribution. If there's an established list of that, why can't we send out a personalized letter to everyone, I guess informing of them of our restrictions, and I guess a cautionary note, I guess, in terms of entering the community only for essential business, and to, as Ron or someone mentioned on this side here, that if you're coming from a hotspot, that please stay where you're at, and respect that we're trying to maintain the health and integrity of this community, I guess, in terms of prevention of COVID-19. That information or that database has got to be there so that we can send out a letter immediately, and maybe again when the issue of the checks goes out. Amy?
So we have a newsletter that's ready to go out that includes the information about the Christmas distribution. We were intending to take it around to doors to the local members not in the community, door to door, so we were doing a connectivity survey. We can absolutely add information to that and work with membership to get that list and send it out broadly.
As well as communicate to the various friendship centers in Windsor and Sarnia and London and Toronto. We have a high percent, well, we have half of our population that's located off the reserve. We should make a greater effort to communicate with them. Cody?
Yeah, and another suggestion, I think it'd be a good idea if we started a security committee just to brush up on stuff, to have things pre-planned, to just in case the numbers keep rising on the outside community, it's gonna get worse and worse as time goes on by the looks of things. And to have something in place, have guards on standby, have things ready for, we have 2 weeks now. We could prep, we could meet about it and prep about it. We have two very strong minds that were previously on the grid security right here with us that could benefit strongly. And if the businesses want us to open, there's ways to do that. There's ways we can discuss on things and come up with a different mandate. The committee needs to be set for this type of ordeal here. it involves our whole community, so I think, preparation here is key.
Yep, we identified that yesterday too, yes. Yeah. And I would ask perhaps Lyle and Ron and Keenan, if they so wish to spearhead that effort if they could, based on your experience.
I think me and Lee should jump on that too.
Sure, that's, we
Our
have a full
security
committee.
expertise.
We can identify those five then as the committee to act on the security matters that Cody has identified and those issues as well that we identified yesterday.
I'd like to be part of that.
Yep. And anybody else that wants to combine the free time to hop on board, they're welcome to do that. More than that.
Just a thought in terms of context. All the discussion and initiatives are absolutely essential. But I'm thinking in terms of the overarching mandate that comes from council table here. And the picture I'm getting is this big net, a safety net.
Yep.
And I think any of our initiatives should be under that mandate or context, the safety net. And particularly with respect to all our membership, and that's on reserve officer, so to speak. And there's two components in that, the elders and our babies, our youth. That safety net should be the overarching mandate with respect to any task force or any ad hoc working group in terms of actual safety. Because when you look at that safety net, you're not only talking about policing, physical safety, you're not only talking about personal health safety, you're talking about all of those things integrated in a tight fashion. That safety net should actually be the thing that binds any of our initiatives from this table. So that group that was just designated, they should have direct access within that net to all the resources and all of the services that we have. And I think we're going to actually end up creating more in terms of that safety. It's not just a policing. If you're talking about police, it's just not policing. It's basically peacekeeping. So our mandate for police services has to be broader in that context. Because right now, when we kill ourselves by individual initiatives, and we have to have that safety to tie everything together. Right now, as soon as you put on a police uniform, you're a sitting duck. We have security at the bridge. We're describing as safety pylons, something you run over, that kind of stuff. So the safety net would eliminate or rapidly erode individual targets because we're doing it as a nation, basically, as a global initiative. So that mandate has to be in a broad context. So everything we do is within that safety net, and we have to mandate ourselves to work seamlessly together in that context. And I agree, the communication is the big ball we drop all the time. Our most vulnerable in the community has to be communicated to them that the whole nation has your back, and this is how we're doing it. So anyway, I just share that in terms of context. When we move forward, it has to be in that with that. You can call it whatever you want to call it. It's a mandate, but from this table, it's our new norm in terms of cultural practice with respect to safety, that sort of thing. So anyway, I share that in terms of we've got to have that as our context and our focus when we move forward.
I totally agree with that, organized thought there that as we move forward, I guess that we have to look at developing some type of pandemic action plan, I guess. Under that broad scope of mandate, there would be all these sub-activities or groups. One is we just identify it. on that. Other ones would be specifically addressing the needs of the elder. Another component would identify housing issues and education issues, et cetera, et cetera. And we would break out those responsibilities to some, I guess, within the community around the council table, but also looking at task force, et cetera, I guess, for the sake of better words, to do that. So with that, I would entertain a motion based on the point that's been brought forward by Burton, that this council mandates the establishment of a core working group to develop a COVID-19 specific policy and action plan, and it report back to council as soon as possible, and that they be mandated with that task immediately, and to utilize the resources and programs and budgets of the First Nation to meet their goals and objectives for that. Now to move it to that effect. Moved by Burton, second by Cody. All those in favor? That is carried. In relation to that as a subgroup, I want to set in motion the security action plan identified by Cody there and others, namely identifying Ron, Keenan, Lyle, Cody, and Lee as the members of this, and I'm sorry, I didn't mean to exclude you, but thanks for reminding me, for this security initiative, and that they, again, be given the authority to utilize the programs and resources of the band to work on a mandate and to report back, I guess, with a budget for their purposes, to include all the activities that they can identify. Can I have a mover to that effect? Moved by Cody, seconder, please. Second by Elaine. All those in favor of that particular motion? That motion is carried. I want to have a follow-up meeting this Thursday or Friday, I guess, in terms of actions that we have identified today. How's everyone's schedule? Just to provide an update and perhaps to provide opportunity for additional decision making, I guess, in terms of all of the items that were discussed today.
Pretty free until we get our COVID tests.
I just have Thursday.
Thursday morning?
I'm not available.
Me and Keenan have that meeting on the 19th.
What day is that?
Thursday.
Thursday morning?
I didn't get an email on that.
I still didn't get no information on that either.
Well, Thursday afternoon or Friday.
Friday morning? 9:30 again? 10 o'clock? 9:30 is good? A lot of heads are nodding. 9:30 then, on Friday morning? Here? Yeah, works here. And this time, Marcia's gonna bring donuts and coffee. Volunteer.
Do we need to do a motion for the two closure? This group?
The school closure?
For the whole closure?
Oh, yeah, that's good. Additional questions?
Yeah, just a point of clarification. I just wanted to, is the core working group from the first motion the same group that was identified in the second motion?
No, I'm looking for volunteers for that.
Okay, so you're still looking for delegates for that core working group?
Whoever is available, I guess, to work on the core working group, identify your availability with Feeny and Marcia?
I'll volunteer.
Okay. I'm on that group as well. Elaine, Neva, Cody, Lyle, rest of council?
Rest of council.
All available, excuse me, council as well. Can be on that particular one.
Can we set a meeting time for that now?
Yes, we can do that.
I think, Kyle should be part of that.
Yep. And any other staff person that we can draw into a fold there, maybe we need the chief of police here, eh? Might be a good idea. And the head of the fire department, or any other type of support services that we have. How was everybody on Thursday with this particular group?
Afternoon.
Afternoon?
I actually have possibly my own health testing that day.
On Thursday?
Yeah.
Wednesday? Everybody available Wednesday? Let's say Wednesday at 1 o'clock here. And we'll do monitoring and a discussion on any follow-up as a result of what we identified today. Maybe we'll have a report back from Kyla and James and others, I guess, in terms of where we're at. 1 o'clock Wednesday?
James, did you get a hold of Leslie Henry Riley about the presentation on the 18th that she doesn't come?
Yes.
I have a couple of questions real quick.
Wait,
Community
I
members?
need a motion here to, I guess, what was it, to close the school? To the departments? I need a formalized motion to close the departments for the 2-week period, up to 2 weeks, I guess, and that the necessary actions that we have identified be undertaken as a COVID-19 action plan. Motion, moved by Cody, second by Ron, all those in favor? That is carried. There's your blanket. James?
One last item I almost missed. I have been asked whether we should put the work on St. Anne Island on pause. Technically, it's through a WIP incorporation. The question is, it's on pause.
We could defer that to the ferry board for their decision.
Who was inquired on that already, that was a suggestion by he approved.
I communicated with Lauren last night, and you posed the same similar questions that you guys are bringing forward there, that, yes, that I could concur, I guess, with any actions that he gets out of his board. And, that company has its board of directors, and I respect their decision-making capacity. They know my feelings and what they should do, and they're going to act accordingly.
You talked to them, that's covered.
Yeah. The same thing with the other corporations, with the asset management at the plaza. We would allow them to work on their appropriate action plans, and I understand that's happening. As well, that message should be sent out as well to Taganing Enterprises. You can't leave the field. Marcia?
This is just a suggestion because transparency and communication to our membership seems to be a big one, issue. So I'm thinking, I don't know how many households we have on Local Island, 400 plus maybe. Well, if we were able to get contact information to those houses, phone number, whatever, I would be willing to, if we divide that by 12, that's like 33 homes that we contact personally by telephone, just to let them know that what we're doing. That would send out a really good, positive message that we're really committed to keeping our community informed. So when you break it down like that, if those phone numbers are available.
Time-consuming exercise there, I guess you can trace them down numbers, there's some are private numbers, et cetera, and,
Right, I'm thinking of the public numbers.
I'll leave that to staff persons to undertake on behalf of them, because that's what you're paid for, and go to it. Oh, we're getting more hands here, I'm trying to wrap up, but Keaton, then Amy, then Lee, then Neva, and we'll go around again.
So just a simple question is for you, Chief.
Yep.
I know, just, from past experience being on council, you're basically the go-to guy.
Yep.
So one of the things that was identified a long time ago was that the chief had access to an emergency fund policy. So that's one of the things we haven't talked about here. We've talked about a number of things. And I don't think we got everything, but I think we're pretty close to it. But I think it's important that the chief has access to some sort of an emergency pod, where things that just kind of slip through the cracks, that he can use to address, whether it be housing, whether it be, or if there is an outbreak. So just thinks that, you know, is it becomes a tool that the chief has access to, rather than trying to convene all of us together to get a motion in place, so we have something to work with. I just put that consideration out there. I think that the chief should have access to something like that.
Discussion? James?
My understanding is that fund still exists, but it was moved to administration. So it currently sits there, so that could change.
Well, take it out of administration. and give it in.
So the direction from our auditors at one point was that it should have a process through administration, but you guys are currently still in an emergency.
The council is my administration, and they'll give me construction on how to utilize it. I need questions answered, I'll bounce it off them. I'd see that hand over here.
I was just gonna say, we did have that in place, and it was with, both
It's still
director of operations and the chief.
I'm just gonna go around the table.
Okay, this is going back to the first wave. Can we start, supplying the food bank with, a lot of the complaints, or not complaints, but a lot of suggestions were that the food bank wasn't giving enough food or healthy food? Or do we start making sure that they have that now? You know, it's only 2 weeks, this could last another. So do we get a head start on making sure that they have some, you know, people dietary needs and other, but just other packages that they're giving out over there?
Excellent point, yeah. I hear that complaint all the time in terms of, you want us to live on mush and starch. Marcia?
I'm in support of what Keenan just said. I think that's important. Because there are emergencies, and it should be left up to our leaders to decide, yeah, this is an emergency, and I'm authorizing this. And I have X number of dollars in this budget. I don't know what the amount was. I thought I had heard in the past it's like 30,000 that was available. Is that correct, James?
It has to be 40 or 50.
I think it's 50,000. Right now, you know, through direction from you, we can provide the cash. So it's really up to you if you want to change that process, but it used to be a direct decision by the chief, and so that piece has changed.
So.
Keenan, you want to suggest a amount? You brought it
50,000.
50,000? Well, you're 75. Moved by Keenan that we give the chief the spending authority for an emergency fund up to $50,000. Moved by Marcia. All those in favor?
Kind of a question.
Question on the motion.
Yeah, I thought we were doing that process of giving yourself and the director of operations a higher spending authority anyway. Previous to this, I thought we were going up to 100K at one time. Maybe, and installed at this table, this current table, of saying how much money do we have? So I want to get that clarified. Are we double, you know, redoing this? Because I thought we were looking at redoing that and other directors having higher spending authority for their programs, but that would be justified because under the emergency circumstances, I think. And I have another comment, but I don't know, maybe they can answer that right now.
I think for clarification, because I held that up for approval for the spending authority for the director and the chief and the finance person, because I looked at, we need to amend our financial regulations. And there should have just been an appendix to the financial regulations that we're increasing the spending authority as per the financial regs for these positions. But we don't have that yet. We haven't discussed that. So this is a different thing in my mind. This is a pandemic and the potential crisis that people all go to the chief for everything. And so I think this is separate, this 50,000 spending authority.
It's emergency.
Right.
Yeah, that's the way I hear it.
It's different from, sliding authority, right?
I gotta go this way, I respect the circle here. Eva,
Last term, what we did is we applied for dollars through the government that was there for the pandemic. So we submitted a budget, and we also had different things that we put on there to get covered. So like the birth security, the roofing, all those things are covered, and we updated it, resend it if there was another, like if you could send it. So I'm thinking that process is still in place. So for this budget submission for more COVID money, that we should include the new security training, the cleaners, roofing, refresher, whatever they need to do, and whatever other support staff go underneath that funding, because that doesn't come out of, it may come out of that funds temporarily, but it's reimbursed, yeah, to the government. So that's a process that was happening last time, and under that, Chief and Council directed the chief and the DO at the time to work together to identify other expenses or utilize that funding and submit it or add it to the budget. But we also got an update following that. So I'm wondering if that can go on the agenda for Thursday about what has been funded, what we put in for it, what we received, and what's the next step.
okay. James and Marcia.
So these are all good points. So what we were talking about, the 50,000 is a discretionary fund that was already budgeted. So just giving chief the authority to spend out of that fund as part of its budget. The COVID emergency fund is another item that exists, and the spending authority would be more for, we have to pay for 60,000 PPE. We don't have time to go to council, so we're going to temporarily give ourselves a spending authority since we already have that as direction. So I think for now, we want to move that 50,000 back to the chief's budget, would be what we're talking about.
Okay, we're making it thoroughly complex here, but go ahead, Marcia.
Okay, my concern right now too is what is happening to the renovation for our homeless
Yep.
shelter. Is that still going?
I'm glad you brought that up. I have a discussion, ongoing discussion with an individual who wants to, I understand, allow the use of the facility, I guess, on the reserve here for the homeless. And I got to pick up with that discussion this week there. And hopefully I might be able to report back on Wednesday or Thursday or Friday, whenever we meet again. And hopefully I'll have something solid to report on that. Use either for the males or the females, depends on what we identified as the greater need, I guess, of individuals. No, I'll follow up on that.
Okay.
So have we decided on an amount yet? We're going round and round here. Give me an amount. I had that 50 there, I was going to cast a vote. This gentleman over here, he interrupted me.
Tried to boost it up for you.
Yeah, 100,000. I sound like an auctioneer now. 75.
I'm comfortable with 50K 10 years ago.
Yeah.
Yeah, the
It's,
price of everything tripled, quadrupled over time.
Yeah, and it's identified as an emergency fund. as opposed to anything else. The motion is amended to 100,000?
Yes.
Is the seconder good with that?
Is that 100?
Yeah.
Yeah.
Okay.
We agree with that.
It's been amended to be identified as 100,000. All those in favor of that motion? That is carried. Lee?
Just a footnote to that motion, if we could have administration do timely financial updates on the expenditures of that and the accounting. And I say that with a specific point of, it has to be fluid because $100,000 is really not sufficient in the global So do that financial accounting in the terms of the safety net, how it ties together on behalf of the whole community. So the expenditure reporting should be in that context. So it'll be determined how sufficient or insufficient that is. So anyway, we need at this table kindly financial updates on how that is being expended, so we can boost when necessary.
Yeah, I like that. To complement that suggestion, I think that we should identify internally all those monies that are available, I guess, for this COVID action plan. I haven't got a handle on that. Like I mentioned earlier, that I identified some amounts within Ontario Works, but I also understand that there's also additional federal dollars coming down too, and other monies as well, and I still haven't got a handle on what the bottom line on those resources are. Cody?
Yeah, just another suggestion. Since we started, we're kind of in a fog with the financial standings of what's going on here. And my suggestion is, we have a lot of band members that are qualified accountants. Can we hire somebody to help our finance department to see if they're in a fog as well? Because these questions keep popping up at every meeting.
Yep.
Of what we spend at financially, what's coming in, what's going out, what programs have the certain amount of dollars, what are we dealing with when we're saying yes and no to different things. So I think it's really beneficial for us to hire a couple of accountants to work with our finance department. You know, like, it would be really nice to see a nice chart to see what we're sitting at right now. But we've been asking for that how many times, and it's not been occurring. We were promised that the first week. The next meeting came along, we were promised that again. I didn't say it, but you know, there's a little lack there. So I think it would be key to hire a couple of accountants to see what's going on there in that department.
Well, Cody, on that, I'm going to suggest that we're going to go on camera just before we conclude this meeting to address some of those issues you identified. Okay? Neva, and then Ron.
Just an attachment to the communication going out to community members, if we can note on there that if family can spread to family who are not in the community, to send in an updated address, phone number, and where do they direct those to? So that mail out and that kind of communication can be updated on their database.
Good. Ron?
Yeah, going back to, again, talking about community and vulnerable, and safety net or umbrella for the community. I suggested this the last time, and I hope it doesn't fall on deaf ears again, is that we purchase freezers, like transport freezer trucks, and a fridge type, so that we can start storing meat and other things in there, fresh produce, and start buying it up, because there's gonna, if this really does hit, and it looks like it's hitting pretty good, it's crippling the United States already, it's gonna start ramp up here in Canada, and start getting that, because the last time they ran out of beef or red meat and poultry products. So I think, I know we have fish and we can get some of that stuff off our fishermen, but there's other things, dietary needs our people need. So I would suggest, you know, that we take a crack at getting some of those, or walk-in coolers and freezers. Be quick.
I can offer butternut squash. Everybody seems to be helping themselves. Might as well put a sign up.
I'll say like Ron was talking about there, like, providing the coolers, fish. Could we be providing our hunters with ammo and gas? And they could be providing food for the community too. I see Kevin Pointing is giving out gill nets and ammo. You know, that'd be another source of food that we could get right here.
Or transportation to the calls that are coming up.
Ammo, gas, I mean, you know, guys are going out there shooting 30, 40, 50 guns a day, put that in the freezer. But they need that ammo, they need that gas, that's the kind of.
Place to store.
Right.
Okay, we'll put that on the agenda for one of the, working groups, I guess.
A quick question about community. We're communicating with community, planning to put out information and stuff, but we have community that are calling up saying, we want to be tested, when is our turn? What would you like us to tell them? Do we want to test community, or do we want to just say, this is why we're doing it? There's not really a reason for you, but I don't want to say that. So what would you like us to tell them?
We recognize their concerns, I guess, and stuff like that, but at this point in time, to maintain the operation of essential services, that we have to establish some priorities. And we've gone through a discussion in identifying those priorities this morning. And I would suggest, is there any way that the clinic in the plaza where you can help out, I guess, with the testing, or any of the sites in Wallaceburg that are nearby and that we can transport them to? We have transportation.
Oh, yeah, the other sites are willing to test people. It's just, we've had people stop by at the health center already this morning. We've had people call, we've had people offer money. Like, I'll give you $50 if you do my test right away. Nobody's taken them up on that yet, but,
Did you tell them to come back after hours?
well, I've had people offer me money for flu shots before when the states didn't have any. They were like, we'll pay you. It's like, oh, no, I guess not. No, go away. It's tempting at times, but, so we want to kind of make that message of, I don't want to say that they're not priority, but in the plan for safety, we want to make sure the workers are safe to work with communities. Shall we say it like that? Is that?
We can coax some wording out, I guess, to the
Yeah.
effect there, that please do, there, that we're not ignoring them, is that we want to maintain our essential services. And, that requires personnel, and it's important that they're tested, I guess, to ensure that everything is safe.
Yeah, okay. Now, do you want communication to be approved by you, or do you just trust us to put stuff out, or how do you want to do
I would
that?
like to look at a copy of it, yeah.
Okay.
I wouldn't take very much, quick email and quick review. Well,
Just a quick question, I guess, since we're talking about a good number of people being tested, and we have, where I told yesterday approximately how many you guys can test in a day. That being said, are you gonna extend the hours? And can you, because you have a courier service and some other things, and what time those hours are off reserve? So I was just wondering, to get the max, to make this as painless as possible, I guess, for use it as well as people waiting to be tested.
We can't extend the hours because of our courier system. I'm not sure if we can gather them and then drive them in ourselves. It would be something, that's what I said. We have to look at what we can do with the labs, what we can physically do. Because we have, it takes nothing. You just stick the thing in the person's nose, wiggle, wiggle. But there's data input, there's checking addresses, or checking health cards, all that stuff, plus putting it in and packaging it. So there's a bunch of steps, and then cleaning in between. So we have to make sure that we're doing it safely, not just the actual procedure, but the actual act of bringing people in. The other thing is that we have a scheduled flu clinic on Thursday. I'm wondering, do we want to put that on the back burner, or do we want to continue with testing until that's done and then do the flu?
My question would be this: can you locate the flu clinic on another site?
We could, but we don't have people.
Okay, you don't have enough personnel to
No.
do those activities.
Yeah, they're the same people that do those activities.
In terms of the flu testing, can Chatham Kent across the way here pick up on that?
I'm not sure if they're testing or how much testing they're doing. We can certainly ask that. Plus, we can ask about any type of assistance we can get from Lambton Health Unit. Maybe they can come down and do our flu shots for us, or if they can help out with the testing from our site. So we can look into those things.
Okay.
And then what we need though is a clear number of how many tests do we need. Like I'm not sure how many employees we have and things like that. And there's also the call-in casual people that come and fill in. We have to gather those all up and things. So that's why we want to contact through the supervisors, who are all the people that are employed in your building.
We'll have to rely that coordination to James there, that, I know you have your limitations of cycling 4 an hour or something like that.
Something like that, yeah.
So that is a triple, I guess, in terms of the number of employees that we have. But I guess our focus would be those essential workers, I guess, at the top of the list there.
Yeah, so we'll coordinate that list. We'll send it to you just to make sure that that's in line with what chief and council want.
Okay.
From there, we'll get numbers and schedule times and things like that. I'll be in contact with Home and Community Care to pull their nurses if we possibly can that are trained in testing, and then contact the health unit to get any support with immunizations or testing that we can get.
Okay.
And I would suggest to all of the chief and council as well, that if you haven't gotten the flu shot, it's probably a good idea. My fear whenever we have a pandemic is that what's happening now, we have a coronavirus, which is like a cold virus. It's hard to make a vaccine and things for it because it's ever evolving kind of thing. We're entering flu season right now. It's always a fear that something will happen and something will mutate. Somebody has a flu and the coronavirus at the same time, and it makes some sort of weird other type of bug. So if we can get as many people immunized against influenza, that'll cut down the number of people that are going to the hospital, that are showing up for testing and things like that. That it'll help minimize that and minimize the risk of mutation and all those other kinds of things.
Sure.
Can you do a drive-by clinic for the testing of COVID testing? Like, the reason I say that is because it would cut down on the cleaning time. And that's the biggest issue. If people are in their cars and they come in and they can get tested, or come by and get tested. I'm just throwing that out there. I don't know a whole lot about it, but I'm just saying because that seems to be to get the bulk, or you'd have a room like this and you just put up like a plastic barrier all the way around the walls per se, and even partition it off with like plastic, like you do for walls or whatever all along here, and you just have partitions and somebody just come in and spray it down. That way you're not physically touching a bunch of stuff. Just thinking outside the
We're
box.
gonna have it at the tent, the isolation tent.
Yeah.
I can ask what staff thinks, because are you talking about just people being in their cars?
Well, yeah, because I mean, they do it at other places.
Yeah, they do.
And they get swabbed. That's what I'm saying. I didn't know if there was any difference of cutting down, because you're saying you're limiting to possibly 4 an hour. And if you want to do bulk, just have people come up. If you could have, your 3 nurses or however many nurses you have, hit 4 cars at once and boom, they're gone. And put them in their little vials. That's all I'm saying. Just food
We
for
can-
thought. I don't
Yeah,
know.
we can look at it. I don't see, other than weather, why we couldn't do it that way.
Let's give her a try.
We can try it, we can figure it out. It's a good suggestion.
I think that's a good suggestion. We'll pick up the
Yeah.
numbers a lot quicker in terms of tests.
I agree.
We talked about that isolation tent, and that for this period of this crisis, that Kyle is going to be in charge of the isolation tent. Do you need a motion, or is that? Because it's.
In charge.
I guess we would need a motion, because it isn't really under anybody's authority, right? It's just, it's kind of like its own little entity floating around, and the reason why we're using it is because we were told to use it because other programs want to take it over. So we were trying to get stuff in there so that it's still available. I know a
Was it
lot
something that
of,
was loaned to us and now they gave it to us or something like that?
I'm not sure on that.
James, we were looking into purchasing one, So we talked to the supplier and they said, we've actually sent one and the community no longer needs it. It's in transit. If you want it, you can have it within the next 4 days. Just coordinate with IFC. So IFC said, yes, we've already paid for it for another community. So if you want it, we'll have it delivered to you and set up at no charge in the next 4 days. And then they called us the next day and said, it's going to be here this morning in a few hours. So it was severe, and so we had to scramble to decide where it was going. But obviously we took the opportunity because it was at no cost and it could have been lengthy to procure something like that.
The bottom line is free.
It was free.
Make a motion to use it.
That Kyle received that.
Second by Marshall. All those in favor? That's carried.
One last thing. too.
Oh, okay. Sorry, Lee.
Is there anything in place, or how do we do this? Because I received some information about people who get COVID don't want to self-identify because of the negativity that it's attached with. And I know she gave me permission to use her name, Gail Manette, said that it wasn't a very good thing when she self-identified. People were very negative to her. How do we support them? I mean, they're still our community members and we need to support them. She was taking care of her grandson. And a lot of people, they just distanced themselves from her. They didn't want to help her out and she needed help. She couldn't go anywhere. Like she had to stay home and take care of her grandson. So we need to support these people too. They're our people. And I know our ancestors wouldn't neglect them and they wouldn't practice some of the negative things that are being practiced and being said about them. We need to support them. And how do we do that?
Keenan.
I can tell you what my family did, so she's a good customer at Campground, so when she went through all that, she got hold of us right away, because when she posted just like more an FYI for the community. So she did it with good intentions, and she got all that negative reactions on Facebook. A lot of the meeting things happened to that process. So what we did, our family, we were taking stuff and dropping stuff off at her porch. And then because she frequents the store, so her and her grandson, they would go for a ride on the four-wheeler and they just stay away from people in general. So they needed something to do. So the other thing that we did was we would put like bowls of ice cream, that kind of thing, because that's maybe what they came over for. We would put that out on our mailbox and they would grab it on the way through. And then the other thing is if she needed grocery items, right? So she communicated to us that, I need this, I need that, so we would go to town to get that. Right? So we were trying to offer her any support that we could, and we also did Skyping with Sammy, right? Because he was isolated too, but he was starting to get lonely during that second week of isolation. People need to understand that, all the bad, thing, and I think there should be communication that puts out, because this is based on experience. This is what's happening to people in this community that have had it, right? So it's bad enough dealing with the sickness. They don't need any additional demeanors, coming to them just because they, had COVID. I think that's critically important because these people started to feel bad. They didn't want to associate with anyone. They got ill feelings towards other community members and things like that. What's happening? This started to snowball. So, and I was like, holy moly, it's like, I thought we were First Nations people. What's going on here? Like, why are we treating one another like this? It blew my mind. And then to witness it, right? So we would have, so when she was out of quarantine, she started coming back to the store. And then other customers would come in behind and see her leaving, right? And the first thing they do is question me, how could you let her in your store? Right? And it was happening at other businesses out here. And it's like, wait, she's in the clear. And, there seems to be that, lack of acceptance back into like the regular routine things in this community. So I think that's a very important piece that needs to be put out there as well. These are still community members, they're still your neighbors. And for a lot of us, they're still our family. You know, people get too crazy about things out here, and that's the thing that I don't like. So I think there should be some sort of communications, like how can we say that to people? You know, that simple act of kindness goes a long way. So I think that, and that's something maybe we communicated on the radio.
Or even the flyer that goes out, something addressing that we take care of our own. You know, by providing if we can be of any kind of help to them, let's be that help. Because I did the same with Gail. A lot of people wouldn't go to her place and drop me home. And she was under quarantine for a month because she had her grandson with her. So they added 2 weeks onto that. So that's a long time to be alone.
James, Derek, and Bert.
It just seems like a good time to make everybody aware. Really, under the law, it should only be health professionals that are made aware of the names of who's positive. And that was the protocol we were following. And counselors last time were asking why can't we have access to the names? And so I did talk to other communities. There was an extreme example up north where council had published the names of COVID positives. And I think one person was assaulted as a result of that. So I know that sounds like an extreme example, but a lot of that framework comes from the kind of protections for people that say have a HIV positive test, right? And when you think of it in that way, the same kind of stigma can occur. And so we do all have that duty because we may become aware of who the people are. In some cases, they self-disclose, but in other cases, we have to be very careful of that because of that risk. And I agree, there should be ways to try to urge the community to be more compassionate, but it's something we should be aware of.
I don't think we're talking about disclosing anyone's names, it's just that when they self-identify, they just had a negative reaction to that.
There's negative reaction to contacts, people who don't have COVID, but there's negative, like when people call up, that person was a contact, they talk to that person all the time, and they're in my store, what's I supposed to do? And it's like, I can't give you any information, I'm sorry, but we can follow up and make sure the people that we've put on quarantine are quarantining. And that's all we can do with that. We can put it in, like, public service announcements would be a good thing. Videos, I know different First Nations have people who've had COVID, put out messages to the community explaining this is how you feel and this is what happened to me and things like that. So they're aware of how easily it is to get and how you're feeling and what to look out for. I'm not sure if any of our community members are at that point where they would want to share that just because of the negativity, but it's an option.
Who was identified last when? Derek?
Just to go over some of, like I've been listening to everyone and coming up with some ideas to support the communications. So I think it's a key thing to work with Kyla and create a lot of content to distribute. And of course, you know, automatically we use Facebook for just about everything, but and then we kind of like do the printing. And one of the things that I thought of that kind of would be maybe easier for everyone to work with would be to create I'm calling it a podcast, but we can use Zoom. Like we can connect on Zoom, and with Zoom you can record any type of conversation. It's like everyone uses Zoom here, but that would be a good way to distribute or to communicate like an episode, a podcast, and have like one based on security Or another topic which a counselor could talk about would be elders. Another one could be a topic on children or education. And just to get that, and you can also promote things with it. So it's kind of like, it's like a radio show. So we can promote the safety on everything. We could create a format for this. Like if I'm the host, I could do an opening, talk about maybe the COVID numbers that we have, and then go over safety, have the interview, and then at the end, reinforce like the safety and kind of have a news update in there somewhere, just stuff like that. And whatever we produce through the podcast, that could be easily translated into a weekly newsletter that I could work with Kyla with to get that information out there and just have that workflow and utilize it. I don't think it would be a huge undertaking. I could dedicate my focus currently on that since I recently just was under a lot of pressure to rebuild the website and all that kind of stuff. I was like focused on in the newsletter, but now things have opened up to where I can really focus on these ideas that I'm coming up with. Also, we can have it as a weekly podcast. We can have the chief, for example, as a weekly contributor, like say a statement. Chief and council directors, community members as guests. We can have people like we can connect with the community this way too, and have them as guests and to voice their concerns, and just talk about the pandemic action plan and the policy that we're creating, and just to get that reassurance that the community is looking for. I think that would be a good way to utilize what we have. And I was thinking about too the people that have had COVID, and if they're kind of feeling negative effects from other people in the community, maybe we could approach one of them and have them create a group where they can meet online and create like this support group within their own people and have that private, and maybe we could set that up through our Zoom or something like that, just to offer support for that. That's all I have.
Okay, great stuff. Planning a lot for us in 14 days.
Yeah.
Cody?
Yeah, I just had a suggestion. I was wondering if we have programs like home and community care and social services and stuff like that. Would it be possible, let's say a COVID positive band member doesn't want to, have to deal with all of that? Is there a number that they can call confidentiality to help them quarantine? I know when once they get the bad news that they have COVID, they're really highly recommend that you stay home for 14 days. Well, then they go into this panic mode. They need toilet paper, they need groceries, they need dog food, they need baby food, they need wipes, they need pampers, they need all this other stuff. Is there a way we can have programs work with them, and let's say somebody has it and they need to go out and get this stuff, we could say, stay put, we're gonna take care of you, we'll drop off a load of groceries to your doorstep. Nobody needs to give any names or anything, just need an address and maybe a hotline. Because it is important for them to stay home for the 14 days when they have it. So that's just a little suggestion I have. It helps the COVID carriers stay home. They don't have to need to go. We bring them a can of Folgers and groceries and stuff. They can have their coffee at home. They can have their breakfast at home. They can have their stuff brought to them, help them quarantine.
Sounds like an excellent idea, yeah. James will get right on it.
And the health center would be the contact, so we'll support them in quarantining and whatever we need. And I was kind of involved in coordinating some of that in the past, so I know a lot of the things you mentioned. We can do that as long as they know health centers a number to call to get that kind of support.
Wasn't it on Chippewa or one of the reserves that they had they would tie a flag or something around their mailbox if they needed some type of assistance?
Yeah.
And the community would respond, programs, I guess, would respond with groceries or something like that?
They didn't have a phone?
Was it Kettle Point?
No, I just said they didn't have a phone or?
That was not
No.
quarantine, that was more food bank, I think. that
Oh,
they-
okay.
But I think it could be opened up for other potential services and stuff like that. And, like you mentioned, diapers and wipes and non-grocery items. Maybe,
I think it was Chippewa, they had a color-coded system, you
Yeah.
could color a card in your window,
Yeah.
and it says, I need food, or I'm good, or I need water, whatever it is, yep.
yeah. I guess we can consider that. Okay, we can go round and round forever here and never get on our action plan. I want to take this opportunity though to request that we go in camera and that staff would be excused.